Now let us talk about anemia. What actually is anemia? Anemia is defined as the reduced oxygen carrying capacity of blood. Now, oxygen is carried by the hemoglobin present in the RBCs. So, if RBC decreases or hemoglobin decreases, anemia can occur. Thus, anemia is caused due to the less concentration or amount of RBCs or low hemoglobin level, or maybe due to both of them. Now let us talk about the classification of anemia. The first basis of classification would be the clinical classification, which is according to the hemoglobin levels. If the hemoglobin level is between 10 to 8 gram percent, it is said to be mild anemia. Between 8 to 6 gram percent is said to be moderate anemia, and less than 6 gram percent is known as severe anemia. Mild anemia can be treated by using some oral irons. Moderate anemia can be treated by injections, and severe anemia transfusion is the only solution available for severe anemia. The second, etiological classification. Etiological classification is based on the cause of anemia. First of all, is due to reduced RBC count. Now, RBC count can be reduced in case of acute blood loss within short period of time. For example, in case of any accident or injury. Secondly, RBC count can be reduced in case of chronic blood loss over a long period of time. For example, in case of piles, worm surgery in the intestine, or maybe due to menorrhagia or polymenorrhea. Polymenorrhea is basically excessive menstrual blood loss. Secondly, it can be due to excessive RBC destruction, which is known as hemolytic anemia. Hemolytic anemia can be due to some congenital cause, that is genetic defect in RBC. For example, in case of sickle cell anemia, thalassemia, etc. It can also be caused due to spherocytosis, which is basically sphere-shaped RBC. Second, it can be some acquired cause, for example, in case of malaria. Malarial parasite stays within the RBCs during its life cycle, and there is excessive destruction of RBCs. Now, this brings us to the third etiological cause, which is due to decreased RBC production. RBC production can be decreased in many cases. For example, in case of nutritional deficiency, this leads to deficient globin formation in the hemoglobin. Second, can be due to protein deficiency. Third, can be due to iron deficiency. Iron is required for heme formation. Its deficiency will lead to impaired hemoglobin formation in the RBC. And this iron deficiency anemia is the commonest type of anemia found in India. Fourth, can be due to vitamin B12 and folic acid deficiency. These are required for the nuclear maturation in RBC, thus deficiency in them would result in the impaired cell division and cell maturation of erythropoiesis. As a result, RBCs would be formed in lesser amount. And number fifth is aplastic anemia. Certain drugs, X-rays, toxins, they suppress the bone marrow. As a result, RBC production and other blood cell productions also decreases, resulting in aplastic anemia. Now, let us talk about megaloblastic anemia. Megaloblastic anemia results from the deficiency of vitamin B12 and folic acid, which is basically vitamin B9. Vitamin B12 and folic acid are both required for the conversion of deoxyuridylate to thymidylate, which is important for DNA synthesis. Now, if there is deficiency of vitamin B12 and folic acid, this process would be hampered, resulting in decreased DNA formation, resulting in formation of lesser quantities of RBC. Now, deficiency of vitamin B12 may occur because of three reasons. First of all, due to a diet deficient in B12. Secondly, due to the lack of intrinsic factor secretion by the stomach cells. And third, maybe if the ileum is removed surgically. Thus, vitamin B12 absorption is hampered, resulting in its decrement. Let us now talk about pernicious anemia. In case of atrophy of the gastric mucosa, all the secretion of the gastric cells will be severely depressed. Now, the intrinsic factor, the HCl, and other components of the gastric juice will be very low or absent. Due to this absorption of vitamin B12, some other nutrients would also be affected. Many metabolic reactions dependent on B12 and other nutrients will not occur. This results in neurological lesions, particularly of the spinal cord. Now, since this is a very serious condition, the name is called as pernicious anemia. Pernicious anemia is basically a broad picture of the megaloblastic anemia and the vitamin B12 deficiency anemia. Thirdly, let us talk about the morphological classification. Morphological classification is based on the appearance. Firstly is microcytic anemia. Microcytic anemia are caused when the RBCs are smaller in size. That is, the mean corpuscular volume is less than 78 cubic microns. For example, in case of iron deficiency anemia, what happens is low iron causes less hemoglobin production, thus RBCs remain smaller. Second morphological classification is normocytic anemia. Normocytic anemia is when the RBC size is normal. Hemoglobin content is also normal, but the count of RBCs are decreased. For example, in case of blood loss. Number 3 is macrocytic anemia. In this case, the RBCs are larger in size. The mean corpuscular volume is more than 93 to 94 cubic microns. For example, in case of megaloblastic anemia. The next classification is based on color index. The first one is a hypochromic anemia. When the color index is less than 0.8, which may be due to iron deficiency, would be termed as hypochromic anemia. What happens is this, that the hemoglobin concentration decreases. As a result, the color index falls and is known as hypochromic anemia. So now we can say that iron deficiency anemia is microcytic hypochromic type of anemia. Now let us talk about normochromic anemia. In case of normochromic anemia, the color index is normal. That is, the hemoglobin by iron content would be normal. RBC count would be less. The RBC concentration decreases, but the hemoglobin by iron ratio remains normal. This can occur in case of blood loss anemia. Thus, blood loss anemia can be termed as normocytic normochromic type of anemia. Now, what are the basic signs and symptoms of anemia? The first and most common sign and symptom is pallor. The patient would come to you and say that he or she is becoming pale day by day. And this pallor is most evident in the conjunctiva, the nail beds, and the palm. Redness is actually lesser than usual, and that is what is known as pallor. Other than this, the patient will complain of easy tiredness, breathlessness, palpitation, and anorexia, that is, loss of appetite. So, this was all about anemia. Everything that we learned today is very important for your professional exams as well as the NEET PG exam. This is all about anemia. First, we learned about what actually is anemia. We learned about the classification of anemia, that is the clinical classification, which is according to the hemoglobin levels. We learned about the etiological classification, that is the cause of anemia, that the causes are due to reduced RBC count, due to excessive RBC destruction, as well as due to decreased RBC production. Other than that, we dealt in detail about the megaloblastic anemia and the pernicious anemia, which are basically some extension of the vitamin B12 deficiency anemia. We did the morphological classification, which is based on the appearance and mostly due to the size of the RBCs. Apart from that, we talked about the color index and its basis in anemia. There are two types of anemia based on the color index. One is hypochromic anemia and the other one is normochromic anemia. But there can never be an hyperchromic anemia because hemoglobin concentration never increases, resulting in hyperchromic. Thus, hyperchromic anemia never exists. So if you like the video, hit the like button, subscribe to the channel, and let me know in the comment section if you have got any doubts, and share this video if it was helpful for you. Thank you.